Hello everyone, and welcome to today's session. I'm glad you're here as we dive into an important topic. Today, we'll be discussing Qatar Prometric 2025, one question you must know. The focus is on Prometric exam revision, specifically the fundamentals of nursing. Over the next few minutes, I'll give you an overview of what you need to know to succeed. So let's get started and make the most of this session. Let's take a look at this multiple-choice question with an explanation about ear drops administration for adults. As we go through this, I want you to focus on the key points that will help you understand the correct technique and why it matters. First, the question presents a scenario related to administering ear drops, which is a common procedure, but one that requires attention to detail to ensure safety and effectiveness. The explanation highlights the importance of proper positioning, such as tilting the head to allow the medication to reach the ear canal properly. This helps maximize the contact of the medication with the affected area. It also emphasizes the importance of gently pulling the pinna, that's the outer part of the ear, to straighten the ear canal, making it easier for the drops to flow in without discomfort. Another key point is to avoid touching the dropper to the ear or any other surfaces, because that can introduce bacteria and lead to infection. Additionally, after administering the drops, it's recommended to keep the head tilted or gently press on the tragus, the small bump in front of the ear canal, to help the medication settle. By following these steps, you ensure the ear drops are administered safely and effectively, which is essential for proper treatment and patient comfort. This slide underscores the importance of understanding both the technique and the rationale behind each step, tying back to our overall goal of providing safe and effective patient care. When administering ear drops for adults, it's important to know the correct technique for pulling the pinna. The correct method is to pull the pinna up and back. This helps straighten the ear canal, making it easier for the medication to reach the eardrum effectively. Pulling the pinna down and back is generally recommended for children, but for adults, up and back is the way to go. This step might seem small, but it's crucial for ensuring the medication works properly and reduces discomfort. So remember, for adult ear drops, always pull the pinna up and back to facilitate proper delivery of the medication. This slide doesn't contain enough information. That's why we're moving to the next slide. When administering ear medication, it's important to know how to properly position the ear. For adults, you'll want to straighten the ear canal by gently pulling the pinna up and back. This action helps to straighten the canal, making it easier for the medication to flow in properly and reach the desired area. For children under 3 years old, the technique is a bit different. Instead of pulling up and back, you should pull the pinna down and back. This change in direction is important because the anatomy of a child's ear is different, and pulling in the correct way ensures safe and effective medication delivery. Remember, the key point here is that the correct positioning facilitates better absorption of the medication and reduces discomfort. Proper technique is essential for effective treatment and for making the process as comfortable as possible for the patient. Connecting this to the overall theme, always ensure you're gentle and precise in your approach to achieve the best outcomes.